So shoulder instability is very common pathology in the shoulder world. We should probably discuss about the two main groups, which are very different one to the other. One group is traumatic shoulder instability, where a normal shoulder goes through trauma, which could be sport related, like rugby or football, or for example a road traffic accident or someone falling off a ladder. And the other group is where instead there is no trauma, but there is intrinsic instability of the shoulder because of a hyperlaxity or a pathology of the collagen, which is the tissue that creates the ligament and the capsule around the shoulder. And so these people tend to dislocate the shoulder despite there's no injury or trauma. And obviously, whether this last group usually is treated with conservative treatment and rehabilitation and exercise and education and changes in the activities they do. The first group might require surgery because obviously there is a mechanical damage and structural damage. The labrum, the capsule are disrupted, and you might want to consider to repair them to regain stability. Obviously, it's very important to consider whether you have had one episode or you had multiple episodes. So some patients come to clinic with recurrent dislocation, and obviously the complexity of the case differs on the number of dislocation the patient has had and the years which have been passed since the first injury. So because of the new technology and materials we have and reliability of the procedure we perform, more and more we've been inclined to fix these injuries early compared to the past, because we see that if you fix it early, it's easier to get a shoulder back on track and back to where it was as normal as possible. Whether if you wait and you have more dislocations, obviously you have bigger damage and the outcome might not be as good as if it was done years before. Also, the more you dislocate it, the more you also compromise the bone stock, so the quantity of bone holding and stabilizing the shoulder, and so you might require a bigger operation where you need to transfer parts of the bone to recreate bone where the bone has been missed, and therefore the risk around the operation are bigger. The operation itself is done as a day case, arthroscopically through keyholes as a day case, and you have a general anesthetic and a nerve block to help you with the pain for the first few days after surgery, and then 4 weeks in a sling before you go back to your activities. And return to sport is between 3 and 6 months.